Hello everyone, and welcome to this audio podcast in this series, the LabZtorm Impact v.3. This is an audio podcast aligned to research surrounding nephrology and what, if any, are the healthcare educational needs for patients with chronic kidney disease or CKD. This is an audio podcast aligned to a storm lobostics blockade and an audio podcast aligned to another storm lobostics production. This audio podcast will delve into looking at the participant identification, sites where participants were recruited from, were recruited in context of this research, and their sort of approach as well. So, to begin with, in around the sort of the research, in line to sort of the research sites and participant identification, the local clinical research networks organization or team helped identify general practitioners and initially where nurse practitioners had been part of the approach as well, and primarily in the southwest of the United Kingdom or southwest England. Though at the same time, the approach had been with and through the Royal College for Physicians, who helped identify general practitioners as well. Or additionally, the Institute of Biomedical Sciences, or IBMS, helped identify scientists with specifically those with clinical chemistry sort of backgrounds, and the Association of Clinical Biochemistry had been sort of approached or had been approached to identify clinical and consultant scientists as well. The North Bristol NHS Trust helped identify sort of renal clinicians or nephrology clinicians, and the chief administrators and sort of the founders for the RPSG, the Renal Patient Support Group, helped identify CKD patients, and specifically CKD patients aligned to CKD severity stages 3 to 5 for a single sort of telephone interview. Aligned to this as well is aligned to this in around sort of participant approach, sort of more specifically. So before recruiting participants, the research scientist, investigator approached participants to identify if so the research scientist investigator approached participants to identify if they were deemed suitable or suitable to be involved in this investigation or in the research through face-to-face and or telephone communication. Contact details for participants were made available for participants to approach the research scientist investigator so that they can retrieve more information about the research before making any formal decision of getting involved. The research scientist investigator, as part of the process or processes, also seek informed consent after providing an overview of the investigation, or after providing an overview of the sort of research in around this works. So in around this as well, around sort of participant identification and participant sort of approach, in around sort of participant recruitment as well. So before recruiting, the research scientist investigated, sort of established whether a potential participant is suitable to be involved in this research through telephone and or email communication. Potential participants had the at the same time would have or had the opportunity to ask questions about the investigation or the research. The research scientist investigator also informed participants that this research this works would be used would only be used for research purposes. Research introductory flyer, information sheets, topic guides, and consent forms were made available before recruiting. Aligned to this as well, quota sampling, something that's been inferred as quota sampling, was used and allowed the research investigator to ensure there is an equal or proportionate representation of participants, depending on age, race, gender, and education. This process also prevented a selection bias. A dedicated advertising section of the Renal Patient Support Group, the RPSG website, was organized by the RPSG team. Once ethics applications had been granted through the university, through the academic ethics. Through the academic ethics committee and NHS ethics panel to recruit patients and healthcare professionals. The web page also allowed the research scientist investigator to display research flyers, participant information sheets, topic guides, and consent forms. The RPSG website details were made available to participants to complete online and through a particular and specific URL. And in the sort of published works or the manuscript in around this works, there's an overview in around the participants recruited, aligned to the different cohorts, the sort of the different cohorts involved and approached. So the next audio podcast will look at sort of the analysis aspects in around this research, aligned to the sort of analysis aspects aligned to this research, and there will be the analysis aspects in around this research will once again sort of delve into some aspects as in around sort of the the inductive content analysis aspects, or ICA, as well. So this closes this audio podcast aligned to sort of research sites and participant identification, approach, and recruitment. This is an audio podcast aligned to research surrounding nephrology, what if any other healthcare educational needs for patients with chronic kidney disease, CKD, and an audio podcast aligned to a storm robotics blockade and another storm robotics production. This has been an audio podcast once again aligned to the LabZtorm Impact v.3. Thank you.